In this video, we will understand fibrous dysplasia in oral pathology for BDS students. So, fibrous dysplasia, it's a bone disease. It's non-hereditary. It is the developmental anomaly of bone due to defect in osteoblastic differentiation and maturation. Any bone can be affected. So again, it's very important. It is the defect in osteoblastic differentiation and maturation. So the primary defect being the replacement of bone by fibrous tissue. The cause of fibrous dysplasia, another important point, post-zygotic mutation in NAS1 GNAS1 located at chromosome 20q132. Next point is the clinical features of fibrous dysplasia. Based on the severity of disease and the tissue involved, they are polyostotic fibrous dysplasia, monostotic fibrous dysplasia. It is commonly seen in between age of 3 and 15 years. Equal gender prediction, that means both male and female are affected. So, in polyostotic fibrous dysplasia, it involves more than one bone. Okay, the site of involvement: femur, tibia, pelvis, ribs, skull, and facial bones, the cervical spine also. Initial findings: bone pain, spontaneous fractures. Curvature of femoral neck and proximal shaft are also seen, and the appearance is shepherd crook deformity. Very important point. Cutaneous pigmentation are also seen. So that pigmented macules are called caveolid spots. Another important term. Endocrine disturbance include hypothyroidism, adrenal disturbances. Some syndromes are seen in polyostotic fibrous dysplasia. They are of McCune-Albright syndrome. It shows triad of bone defects, varying endocrine abnormalities, and caveolid pigmentation. Another one is Jeff's type. So it's only associated with caveolid spots. And another, the last one, Massabrod syndrome. It shows multiple intramuscular myxomas. In monostotic fibrous dysplasia, it occurs in rib, femur, tibia, craniofacial bone, and humerus. It is common in children and young adult. When maxilla and associated bones affected, it shows leonine appearance. Next, oral manifestation of fibrous dysplasia. When jaw bones are affected, it shows pain, swelling, and deformity of jaw. The initial sign, painless swelling of jaw. If it involves mandible, it causes protuberant excrescence of inferior border. That means protuberance of mandible. Some misalignment, tipping, or displacement of teeth also shows. Loss of bone causes delayed eruption. Then if it involved maxilla, commonly it extends to involve the maxillary sinus, zygomatic process, and floor of the orbit. Another important feature, radiologic features of fibrous dysplasia. In skull and facial bone lesions, they show a thick sclerotic border, and it's known as ringed sign, very important point for NEET MTS. The early lesion shows unilocular or multilocular radiolucency. The mature lesion shows radiopaque spicules and radiolucency give ground glass appearance or orange peel appearance. Next one is so the orange peel or ground glass appearance is very important point. Next, histologic features. So in monostotic form, it shows some irregular trabeculae of bone and they are scattered, and some trabeculae are C-shaped and it shows a Chinese pattern. In polyostotic form, the lesions are composed of fibrillar connective tissue and they are large osteocytes are seen. The treatment of fibrous dysplasia are bisphosphonates and vitamin D.